Time now for Restoring the Soul of Healthcare from the Help Care Clinic in Austin.
And once again, joined by the good folks at the Help Care Clinic here on Thursday. Good morning.
Good morning.
Good morning, John. It's great to be with you today.
Sounds like a full house here today. It was nice seeing you in person out at the cabin at the fair last week. And now this week, I understand we have some big announcements to share.
Yeah, this is really a milestone day for us in that when we opened Healthcare Clinic in Austin on February 1st, there were certain things that we said were going to be part of the offerings that members would get included in their membership. And we're really pleased to announce that today we're filling the last piece of that puzzle, and that as of today, many generic medications are going to be dispensed from Healthcare Clinic for our members, up to 2 per month for the members, and included in the membership, that they're able to just get those medications directly from here, and they don't need to have any copay or additional payment cost associated with that. So it's pretty exciting.
Yeah, I was perusing that list this morning, and outside of maybe one or two I could pronounce, a lot of them I just won't even try to go through, but the entire list is available on your healthcare.health website.
Yeah, they just wanted to have Dr. Strobel go through not go through the list one by one, but kind of talk about the categories of medications and sort of the rationale for how some of these were chosen.
Yeah, because like you said, a lot of them are fairly common and people will be familiar with them, and the need for them certainly there. So, Doctor, go ahead.
Okay, so what we tried to do, we're not trying to be totally comprehensive. We're just basically trying to get kind of some representative medications in various different classes, and to deal with a bunch of things. And I'm not at all convinced that this is a comprehensive list as yet. We may discover, gosh, let's do some other things as well. So this is just our first iteration that we're working on. And so the kind of categories that we're looking at are several different groups. Some of them have more than one thing in the group, because you might have a need for one versus another. So, for example, we've got a few different antibiotics that are available, that are common ones, not all of them, of course. We have several different things that can be used possibly for allergy symptoms, some things that could be used for insomnia, several things that can be used for blood pressure treatment or for heart failure symptoms. One of them can have benefit for acne. Several things can have benefit for diabetes. We have some cholesterol treatments. We have some generic thyroid hormone that can be used for some thyroid disease. And we have steroid, like prednisone, that can be used to treat inflammatory conditions. And this is just kind of a representative list of fairly common things, but it's a pretty short list, and it's not a lot of different things that are on there. Some of them could be used for headache as well, and there's even one that has benefits sometimes for attention deficit disorder or tobacco abuse problems. People that are trying to quit smoking or trying to quit other forms of tobacco. We might have some things that could be helpful for that. And as I said, we may change the list over time. It most likely would add to it rather than take things away. But that'll be just kind of part of what we do.
And we should remind people, too, these are things that will be part of that membership. Certainly, if you needed to prescribe something else, certainly you can do that. These are just the ones that are available through your membership.
Right. And these are generic medicines, so they're not very expensive. If we were covering highly expensive medicines with the membership, well, then the membership would be really quite higher than it is now. And then people that take the medications would have tremendous benefit, and people that don't would actually be financially harmed. So, we want to kind of strike a balance and come up with something that could be potentially helpful for some folks. And as we talked about before, Healthcare Clinic is really focusing on lifestyle medicine, lifestyle treatment. And so my goal for many people that are on these medicines is if they are able to make those lifestyle changes, I want to stop their medicines if it's feasible to do so. And when people do make the lifestyle changes, it's quite frequent that that's exactly what we're allowed to do. We can decrease or stop many of their medicines in many cases.
Yeah, and John, that's part of the rationale for covering, including two prescriptions per member. That if somebody's taking 5 medications, we'll still be able to get them a low price on those medications. But that way, there's also some benefit for them if they work hard and decide they want to make some lifestyle changes and get off the medications. They save extra money that way as well.
And what an incredible personal victory that is when you really start taking control of your own health care in concert with you folks, and you're able to say, you don't need to be taking that anymore. You're good to go. I mean, that's huge.
Right. And I don't know very many people who say, oh, I would like a longer med list.
Yeah.
The people who say they need a longer med list usually do need a longer med list, including some stuff for their brain.
Yeah.
Yeah. And as we started out with, there are 28 medications that are on the list right now, and in various categories, as Dr. Dave, kind of outlined. We do expect that there will be, several more likely added, and part of it is getting to know the needs of the members and finding out what kind of things they're needing to have prescribed. And then as we see some things that are more common, that are, because we don't want to stock a lot of medications that could end up expiring. And so we'll strike a balance there, but, keeping it in that, sweet spot of a couple medications that are included. And then if they need more, they can either have them ordered through the local pharmacy, one of their favorite local pharmacy, or we can see if we can get them added, and we would just pass it along with a modest administrative fee.
All right. Well, very good. And like you said, that is a huge announcement. We've got about a little over 2.5 minutes here, and I just want to talk a little bit about the fact that we're getting down to the end of the month, and that is another major milestone, if you will. I happened to go through the Plager building. I was going to stop and see you, but you were so busy visiting with people. Getting this information out, I mean, we're getting down to the last couple of days and got to get people signed up.
Yeah, we're in the last 2 weeks of our summer savings rate. So all along the way, we've, the folks that started in February got a lower rate because we were only open a couple days a week and we didn't have the labs yet. As I mentioned, now we've actually added everything that we've said we were going to have, and plus more. We've got the FibroScan and the InBody, which were a couple things that we weren't promising right up front. So now we're in the last 2 weeks where anybody who signs up between now and August 31st will save $20 a month. Will save at least $20 a month for as long as they stay a member. And so whatever the future rates are, they'll get that same percentage, that they're currently receiving. So this is kind of that last chance while we're not. I mean, we are actually, as of August 24th, we're going to be up to 5.5 days a week most weeks. Where we have a provider here and provide care. So it's, and now's the time when if they go to, healthcare.health, or if they come give us a call at 279-2345 or stop by to see us at, block east of St. Augustine's at 308 4th Avenue Northwest. We'd be glad to show them around, be able to have them see for themselves, what the experience is like and what's included. They can save, it's 6 to 13% from what the rates will be starting in September. And so really now is the time, if they've been thinking about it, because we've heard a lot of people that say, I listen to you every week, and they've been learning more about it. Now really is the time, it'll still be a good deal. It'll still be a good opportunity in September, but it's an even better opportunity now.
Yeah, if you plan on joining anyway, why not save a few bucks and get signed up now?
Right.
Exactly.
And most of the time when we've talked to people about, the final expense of the membership, if you talk to people as though that was the membership price right from the beginning, most people said, wow, that's really a good deal. Well, so when we get to our highest price, so to speak, it's still going to be a good deal.
And especially as you break it down and spread out over a year and look at what you're really getting, it's even a better deal.
Yeah, I mean, most people will save enough on their lab tests to pay, or many of our people will save enough on their lab tests to pay for the cost of the full membership. And then if you include perhaps a couple of, generic prescription drugs if they're needed, that just adds to the value to the savings.
Yeah, absolutely. Good stuff. Days are winding down. You got till the end of the month. Get in on that early bird membership, if you will. Gentlemen, great information as always. Again, congratulations on hitting the milestones that you've been anticipating hitting. That's good stuff. We look forward to visiting with you again next week.
Okay.
All right. Thanks, John.
All right. Have a fantastic week.
Yep.
You too.
And bye-bye. There you go. Health Care Clinic. They've got it all for you. They've added on now the prescriptions. Many of them very, very common. A lot of people are taking some of these. I even spotted one on the list there that I take on a daily basis. That's part of the membership. Find out more. Find out how the Health Care Clinic can help you. Visit their website, stop in, say hi, take a tour, get the information you need, and most importantly, sign up. Again, the last day of the early sign up, August 31st.